Good morning, everybody. I'm here to talk about a special type of physical therapy, which is geriatric physical therapy. First of all, geriatrics is a type of healthcare that is geared towards the elderly, starting from ages 65 and over. And in the 1900s, only 4% of the population are senior citizens. And in recent years, it has bumped up to 13%, which is 40 million people. 1/3 of those people suffer from a lot of injuries and illnesses. Most commonly, they suffer injuries from falls due to independence, but aging causes a lot of things like osteoporosis for the women, and other disabilities. Researchers show that in the future there will be a lot more people that are going to reach the age of 85, and women will live up to more than 5 years, 5 years more than men. And so some injuries and some diseases causes irreversible effects. So geriatric physical therapy will help them regain their independence, some of their independence back. So the purpose of geriatric physical therapy is to reduce pain, improve their strength and flexibility in order to perform everyday daily tasks. They also provide, physical therapists and PTAs provide assistive devices for these people, and they use a lot of gait training in order to get them back to walking again, which is the most important thing. In a PT lab, they would have short-term and long-term goals for the patients. Usually, geriatric physical therapy are in skilled nursing facilities because it has the most abundant senior citizens in more than any facilities out there, and they would provide therapeutic exercises, but mainly to regain strength and help other people who are suffering from diseases like Alzheimer's disease cope with the disease and perform ADLs, or everyday or daily activity of daily living, and also to prevent further decline in functional abilities through energy conservation techniques and joint protection. They use basic range of motion and gait training, like this man right here. He suffered from Alzheimer's disease. As you can see here, she's using contact guard assist, which is a use of the gait belt, an assistive device like the front wheel walker, and a wheelchair. So these people are getting massive help from physical therapists. And also, most commonly used for geriatrics are passive range of motion, like this right here. As you can see, this is passive range of motion of the shoulder. The woman is lying there like a lot of residents in a skilled nursing facility. they are not able to walk, or most of them are in very late stage of Alzheimer's disease. So they would do passive range of motion in bed or in the wheelchair. People would that had suffered from COPD or stroke, any other pulmonary diseases or disorders. They also receive treatment and other modalities like ultrasound, exercises like sit to stand for people who have some partial strength on their leg where they suffered the stroke, or the side of their body. They can regain some strength back. And so geriatrics help people mainly to regain their confidence as they get stronger or progress. One concern that every PTAs or PTs that would work in a geriatric type of environment, they should realize that there will be behavioral changes for the elderly that can affect their therapeutic exercises, as well as you have to minimize the challenges in performing tasks every day. PTAs could also educate other caregivers, body mechanics, or any other type of exercises like passive range of motions, like what I mentioned before, and applying orthosis like splints and all that, due to people who have had injuries in their extremities. And that wraps it up. So, any questions? Matt, you got a question?
No, I'm good.
Victor, you got a question? You gotta ask me something.
Okay. Tell me, please, any experience, personal experience in the field that you remember.
Okay. I've worked in a nursing facility. I was part-time RNA, and I've had experience with gait training. I've applied splints, orthosis, like AFOs. I've applied those before, and I've worked with PTs. I've helped use the rubber bands for simple exercises, and common range of motion, and I've dealt with people who are suffering from Alzheimer's disease and who have had stroke. So,
any particular patient that you remember?
Oh
Any
yeah,
particular case?
yeah.
Can you tell us about it?
Well, I have a lot of favorites that I really love working with, but mainly there's this lady who was in her 90s, and she's very patient with all the therapeutic exercises, and with all the employees and the PTs and everybody. And she loves going on the elliptical bike because she said that her confidence are back because she could move her arms way better. She has more flexibility, way more than when she first got admitted in the facility. So I like working with her. She's very funny. So
Good. Thank you.
Thank you guys.